Hello, my name is Mohamedin Gamalon, nursing student from Notre Dame of Tacorong College of Nursing. So today, I am going to perform taking vital signs. Definition: the measurement of physiologic functioning, especially body temperature, blood pressure, pulse, and respiration. Purpose: serve as guide in meeting the needs of the client, aids in the planning of care for the client, establish baseline values of the client cardiorespiratory integrity. Temperature definition: balance between heat production and heat loss by the body. Purpose: to determine alternation in thermoregulating system of the body. To establish baseline data for subsequent evaluation. Here are the equipment: auxiliary thermometer, cotton balls with alcohol, watch with a second hand, paper and pen. Now let's proceed to the procedure and the rationale. First, identify and explain procedure to patient. Rationale: to ensure correct procedure to right patient. Explaining procedure reduces anxiety and fear, thus promoting cooperation from the client. Good morning, sir. Ako po si Mohamed Ingawalan, sir, ang nurse niyo sa araw na ito. Maaari po bang malaman ang inyong pangalan?
Lay Cano.
Leo Cano. Okay, so ngayon po, sir, pupunan po kita ng body temperature, ha? Assess the client's skin if warm to touch. Rationale: to assess sign of fever. Assess for most appropriate site to check the temperature. Rationale: to save time and to identify the correct thermometer to be used. Gather equipment needed. Rationale: to facilitate systematic assessment and measurement. Wash hands to reduce the transmission of microorganisms. Draw curtain around the bed and close the door. Rationale: to maintain client privacy and promote comfort. Assist client in supine or sitting position. Rationale: to provide easy access to auxilia. Move clothing or gown away from shoulder and arm. Rationale: to expose auxilia for correct thermometer to be used. 2. Placement. Insert the thermometer and leave place for the required amount of time. Place arm across the chest, usually 2 to 3 minutes. Some digital thermometer gives give a short beep when reading is done. Rationale: to provide enough time for recording the temperature. Remove the thermometer and use wipe with the and use wipe remove the thermometer and wipe with with tissue away from fingers towards the tip and read the result. Rationale: to prevent a cross contamination. Inform client of thermometer reading. Rationale: to promote participation in care and understanding of the status. Sir, 37.5 po ang inyong body temperature. Normal po yun. Wala po kayong lagnat. Dispose, wipe, and use contaminated items in a receptacle. Rationale: Confining contaminated articles helps to reduce the spread of microorganisms. And now, wash hands to reduce the transmission of microorganisms. Evaluate the temperature taken rationally to identify the client if normal or abnormal body temperature. And last, record result in graphing sheet for documentation rationally to serve base data for healthcare provider.